Daniel, it's a pleasure meeting you.
Same as here.
Okay. So without further ado, I will ask you a couple questions about, about the company. So if you could just give us a brief introduction to Vocalis and, a little bit about the technology, the founders, just whatever you like to talk about Vocalis.
Yeah, cool. So I'll give a brief overview about the company. Eventually what we do is monitor voice of users, and we try to either predict or get some kind of insight about their health status from the voice, right? So you can use voice for various things. Now there's a lot of also interaction with your phone. You can use your voice, or at home, Alexa, personal assistants. And one of the companies in the sphere that are taking this into the healthcare. And the idea is, if we are already using voice, let's get insights out of it. So we can either get one voice recording and give some insights about what's happening, what the health status of the person that speaks. And also we can monitor, right? So if we have somebody who already knows he's got some kind of a disease and we want to monitor him throughout time, that's also something that can be done using the voice. Okay, so that's generally what we do in the company. It was founded by me and Dr. Shadi Hassan, who is also a Technion graduate. He studied to be a physician. He's an MD, and he was a senior internal medicine physician in Carmel Hospital at the Technion when we co-founded the company. And I was in my first year of the PhD. Prior to it, I did my bachelor's and my master's at the Technion in electrical engineering. I worked in the Army and served, in the Army as an engineer, worked at Intel and Microsoft R&D centers here in Matam in Haifa. And then I started my PhD, did 1 year, met Shadi, and I said, when we started working on it, I said to myself, well, this is a really interesting opportunity. If I really feel like PhD is burning in my bones and I want to do it, I can go back to it in the future. So that's the reason I said, okay, I'm going to leave and focus on the company. At the end of last year, around half a year ago, as part of round A, we merged with one of our competitors, Beyond Verbal, and we changed our name to Vocalis, which means vocal in Latin. And part of the merger, Tal, which is now the CEO, he was previously the CEO of Beyond Verbal, became the CEO of Vocalis. He's also a graduate of the Technion. He studied mechanical engineering. And I am actually in charge of the technology in the company. So I'm the CTO. And Shadi, whom I mentioned, is in charge of operations and the medical. So he's the chief medical officer. We're running clinical trials, we report patients. So there's a lot of operations around this area. Yeah, so that's a brief overview of the company.
So just very briefly, how did you get to voice? How did you, what brought you, to voice and health? How did that happen?
Yeah, so that's a good question. We started with the idea on trying to answer the problem, which was patients who got treated by Shadi. He was an internal medicine physician. He was treating patients daily. They were discharged, and then oftentimes they would come back in a month, in 2 months, they got readmitted. So the problem we tried to solve at the beginning, how we can monitor patients at home, and hopefully we can predict or prevent those readmissions. So at first we started with a hardware. We thought maybe we can use some kind of a hardware, a belt or something to monitor the chest, or maybe like a smart stethoscope. But then also we saw there's already a lot of ideas in this area. So we said, okay, what can we do different And then I understood, okay, we all have a smartphone, right? And we all use it. It was 2016. Still, everyone, we're using a smartphone all the time. So let's leverage this use of a phone to get something good out of it. Okay, so that led us to the idea, okay, let's use the speech, the voice. Okay, so that was the evolution towards the solution that we are working on it now.
Okay. What kinds of markers do you find in voice? I mean, just very briefly without getting, too complex.
Yeah, so I can give you this analogy. What happens especially in respiratory diseases, such as asthma, that most people know, but also COPD, which is actually more common, a chronic obstructive pulmonary disease. It's more common than asthma, but less known. It affects usually people who were exposed to a lot of pollution or smoked, so smokers. Similar symptoms to asthma. And what happens, there's a narrowing of the air pathways. Okay, and you can imagine if you take a tube and you blow in it, you can hear a noise, but then if you expand or narrow the tube, the pitch of the noise, or no, the sound that you hear shifts. So a similar effect happens in our voice, right? When those patients, they begin to flare, there's a narrowing of their airways, so we can detect those shifts in the frequency content. Okay, and this frequency content translated to their voice as well. So this is like an explanation about how our technology works in a sense.
Okay. And I understand that there's cooperation with the Israeli Defense Ministry. Can you tell us a little bit about that?
Yeah, for sure. So actually, it's around 2 or 3 weeks ago it started. So we've been in touch prior with Sheba Tel HaShomer Hospital to collaborate on trials for mostly respiratory diseases. And around a few weeks ago, the army, or maybe it's the government, and they told the army, I don't know exactly what happened, but they decided that this idea of voice should become something that they should look into as well.
For Corona?
Okay, yeah, for COVID-19, exactly. Okay, so they have actually now a few projects that related to COVID, which are not just voice, other ideas as well they promote. So this is something they decided they should do. And quite quickly we got in touch with them. And eventually what happens now is the study is already ongoing. So actually, I think we broke records in the sense of getting a clinical trial to run. It can take on average half a year, because there's what's called the Helsinki Committee, which is the ethics committee. You need to get approved to record patients, or any clinical trials on patients. You need to sign a contract. On average, it takes half a year. We did it like in 10 days. Of course, everyone wanted it to start. And now we record patients. So the idea is patients that get hospitalized or admitted, and we know that they're positive for COVID-19, we record their voice in the hospital setting. So this is one group. The other group are mostly medical staff that they think that they got exposed to COVID-19, but they still don't know. So they send them home for 2 weeks quarantine. And also they do test on them of COVID-19. So we know some of them are positive, some of them are negative, and we record their voice. So eventually we're gonna have two groups. One is positive and one is negative. And the aim is to build on top of this data, which is, let's say, a really good data in the sense that it's labeled. We know each person, his history, medical history, his current status. And the idea is to build a vocal biomarker, which means eventually a solution that can run on one voice recording and tell the probability that somebody has COVID-19. Okay, so that's the
How long
aim.
can that take?
So we hope by the end of this month already to get preliminary results because few more hospitals actually joined in. So we gather not just in one hospital. And also there's a few other groups that are working on the data. So we gather the data to our platform, but we share it, of course, with the Ministry of Defense and other groups. As I said, there's a group from AFECA that they have a strong team that works on speech. So they also take part of it. There's a few groups, research groups from the Army, from the industry, and each group, we have some like a high level collaboration, but each group is trying to get something independently in a sense, and hopefully this way we can tackle the problem from various angles.
Great. On another note, so kind of more generally speaking, you know, we've seen throughout Israel and in the world, entrepreneurs who are, you know, rolling up their sleeves and helping out with this crisis with Corona. And what's your personal, you know, feeling about that? And what do you think about, you know, entrepreneurs participating to help in this special time in the world?
Yeah, I actually think this is, in a sense, depends on which level you look at it. At some level of abstraction or reasoning, this is really hard times to a lot of people, a lot of uncertainty, unknowns. You know, you don't know what's going to happen. People are suffering, right? But this change in the way we live our lives also opens up a possibility to think about new ideas, how to improve our lives, right? So this is on another level, I think people who are more prone to entrepreneurship and trying new ideas, that's the background that they like to work in, you know, because now there's a shift in our lives and nobody knows what's going to happen in a few months. And if you have an idea and if you think you can solve a problem to someone and bring him value, that's exactly what entrepreneurship is. So yeah, I think this is a great time for people who are interested to help. And I guess we're seeing a lot of really nice ideas also on the community level. So it's not just for profit and doing companies, but also non-for-profit and helping your community deal with the specific problems it has. So I think this is really interesting.
Now, a little note on Technion. How do you feel, you know, your whole Technion experience has played into, you know, what you do today and what you're doing with Vocalis?
Yeah, that's a good question. I really like the Technion. So this is also the reason I'm speaking to you for sure. But also when I was in my bachelor's, always there was like a discussion or people were talking how Technion is difficult, which is true. But I think most things in life which carry meaning with them, there are challenges. They're not easy, right? So of course, studying, in a sense, you can say that, doing your army service, raising kids. I have 2 kids now. So again, starting the company, everything that carries meaning has challenges. So the Technion was a challenge, but I really loved it. And that's why I continued here for my master's. And I always try to tell people how a positive, again, challenging, but still positive experience I had here. Because eventually what you learn, in a sense, in the Technion is to be able to tackle new challenges that you didn't see. Okay, so this is what always, at least in bachelors, people say, oh, in the Technion, the exam's so difficult, you do your homework and you do your assignments, but then you get something you never have seen before, right? So that's true in a sense. And maybe in other universities, it's the same. But this, let's say, unique challenge is something that continues in your life later, because most of the things that, again, are challenging, they're challenging because you've never seen them before. And hopefully you have the tools, which I think the Technion gives you, to do something with the challenge. Maybe you fail, maybe you don't succeed, but at least you learn something, and then you continue forward and hopefully succeed on your next attempt.
Very nice, especially since apparently you're connected to a lot of Technion alumni. I mean, you're working with a couple of them at least. So.
Yeah, that's right.
Okay. Georgina, maybe Georgina, Barbara, Yvette, I think that, you know, is there something you'd like to add?
Yeah, let me start. I have one request. Daniel, could you imagine that I've got corona? Like, so you're beginning a sentence, something along the lines of, imagine you've got corona. And then you walk us through in our imagination what an application of your technology how would we experience it? Like next autumn when we have a resurge of coronavirus, and let's say your technology is everywhere.
So imagine you're suspecting you have a corona, okay? And you're scared, you don't know, you feel symptoms, and maybe you were exposed to somebody who was tested positive, and now you don't know what to do. Okay, and getting now a test might be difficult. Maybe you need to drive to some place. Maybe it takes time. So one way you can use our technology is eventually record your voice on the app. Okay, so we have our app. You can say whatever you want, around 10 seconds of your voice, and we can tell with high probability if we suspect that you're positive or negative, of course. And then you can use that information. Maybe it will help you to decide better what you should do. Maybe you should go and wait for a test. That's one thing we offer. Another one is if you already been tested positive and you know you have it, and now you're scared or afraid, you don't know what's going to happen to you. Okay, because as we know of today, it takes at least a week after you get exposed until symptoms start, or at least 5 days, but then another week before people get better or get worse and need more special and difficult treatment. So the use case we see here is you can use, again, same app, record day after day in the first days of your illness, right? You're still feeling okay. And in that point, we can also tell you what we think the direction you're going. Okay, we think you're getting better or you're getting worse. And again, this information can be used to get a better treatment. Because if we know a few days before the deterioration that is going to be a deterioration, you can take some steps to avoid it. Okay, so that's the two use cases for our technologies, specifically for the COVID-19.
It's the application that then, you know, green screen, right? Something that says, you know, you may have it, you don't have it, or is it somebody who contacts you? How does that work?
So it will be in the app itself. So actually, we started a few weeks ago to contact the community and help us get more data. We record also regular people. You can use our website. If you go to vocalishealth.com, there's a link to a survey. We ask a few questions and we ask for your voice. And of course, you choose what to say, so there's no privacy problems. You can count. There's a few options there. Describe an image. and we use that to improve our algorithms, right? So the data we get now from hospitals is good, but the numbers will be in the hundreds of patients, and we want to get to thousands. That's why we use the community, and we're trying to spread the word, so more people will record, and also healthy people, right? So even if you're feeling great, everything is okay, that's amazing, we're happy for you. Also help us, give us your voice. It will help us to improve our algorithms as well, because eventually we need to distinguish between a healthy and somebody who's COVID-19 positive. Okay.
How much money did you raise in your first round?
So our A round was $9 million.
Okay, great.
It was led by a Moon Fund. It's one of the largest healthcare funds in Europe. It's led by Marius Nacht. So he's a well-known entrepreneur in Israel who decided at some point he wants to put a focus on the healthcare.
Great. And how many people are in the company?
So currently we're, I think, 22.
Wow. How many of those from Technion, more or less?
Actually, quite a lot. I think they're around a quarter from the Technion, maybe even more, actually.
Good.
Yeah, so again, I love the Technion, so
Very
happy being here. It's a
Very
great honor.
Okay, so I just want to ask you about competition worldwide. I'm just curious, who's the race? Who's in the race? This is not for. This is just, you know, is it? Are you racing against anybody? Do you have competition?
Yeah.
Is it? Do you have unique algorithms? Whatever. Tell me.
Yeah. So actually, in the world of vocal biomarkers, that's where we are. There a few other competitors. We are one of the leading ones, the largest ones in this area. Most of them in the US actually focus on depression. So in the near future, we tackle different markets. So eventually they want to use voice to either diagnose or monitor people with depression. Here in Israel, we have a competition, and they are tackling cardiovascular diseases more related to the heart. And we are, as I said, respiratory. Okay, so there are quite a few players, but this still is a young industry, right? Everyone, let's say, suffering from the same problems of how can you integrate the solution into a system which does not support it yet. Okay, so that's one of the main challenges we face, and our competitors as well. So it's not just a technological challenge.
Well, thank you very much, Daniel.